Thank you, Mr. Rector. Thank you, Professor Kouroulias, and dear esteemed guests. My name is Mou Chergou, and I represent INBM Applications, the company IBA from Belgium. I am the Vice President of Commercial Operations in Europe, Middle East, and Africa. And it's a great honor to be here today representing or trying to start this collaboration about the future of proton therapy in Greece. We thank our partners at the university, at the National University of Athens, and also Papapostolou for all the great help organizing and hosting this event. If we can go, please, to the next slide. IBA is a company. I will take just 2 minutes to introduce you to IBA and what we do. So we are a company that leads the market in dosimetry, in radiopharmaceutical accelerators, and the theranostics, a new area. Proton therapy, of course, which is the subject that we'll be discussing today, plus other industrial accelerators. Next slide. We are based in Belgium. This is where we innovate and create our accelerators. We've been there for 40 years, but then we're a European company that has worldwide recognition. We are basically the brand name in proton therapy. We have already installed about 80 centers, and I will tell you at the end of this 2 minutes what our goal and our dream when we show you all the dots that we have in our map. Next, please. So proton therapy, as a teaser, comes into place because of the limits of conventional radiotherapy. We do not intend to replace photon therapy or electron therapy, but we tend to our ambition is to mend to the limits of that. So where we have problems usually in traditional photon therapy with high toxicity for surrounding tissues, secondary cancers, difficult irradiation, and local control limited by dose threshold, proton therapy comes into the picture. The next slide will give you the theory of it, which is the physics, and I think I'm preaching to the choir here. This is, you all know the Bragg peak. This is an effect that is known for many decades now. But basically, the protons deliver to the tumor its energy with a very low entry dose and almost zero exit dose. In the next slide, we will see what that means basically for cranioscaphial pediatric patients, where you can see the difference between the left photons and the right protons, that we both deliver those to the tumor bed and the regions of interest, but we, in protons, as opposed to photons, spare the liver, spare the heart, and eventually spare this patient a lot of adverse effects. In the next slide, what we would like to share with you is where are we today in terms of adoption of proton therapy. We have tons of papers, bibliography that we did not have when Dr. Metz talked about his experience trying to establish protons in UPenn and in the US. This data was non-existent, but now we have a lot of data and covers a wide variety of indications. In the next slide, there's even more exciting data. For example, there's a first level 1 study with head and neck cancer that shows actually overall survival difference between patients or cohorts treated with protons and patients treated with photons at MD Anderson and other centers. So this slide by itself should give us all as a team an interest in protons, should give us a motivation to bring proton therapy to Greece and neighboring countries more and more. But then the next slide will actually also show what are the ASTRO recommendations. So the American Society for Therapeutic Radiation Oncology has actually said we have to treat certain patients. We must consider treating certain patients, like ocular patients, like pediatrics, like head and neck radiations and others with proton therapy. Our part of the job is the next slide, which is to give you the best tool as clinicians so you can treat your patients the best way possible. And then our goal, what I promised to share with you at the beginning of my presentation, is in the next slide. So we can skip through these, please, really quick, and go to the next slide. And then there you'll see, can you please press one more time so we can see the map? Oh, okay, maybe we can't. But you can guess what actually this is. This is a map of the world. There are clusters in North America, in Europe, and then in Asia. There's one little dot in South America. But then the closest dots to you are in Italy, are in Israel, are in Egypt. And our dream, our ambition is to bring that, with our partners here today, is to bring that one dot to the University of Athens. So thank you for your attention, and let's do it.